Have you ever wondered what your doctor really thinks when you walk into the room? The truth might shock you. Behind polite smiles and professional words, there are hidden beliefs about older patients that most doctors will never say out loud. And these beliefs can quietly decide how seriously your symptoms are taken, which treatments you are offered, and even how much of their time you receive. Many seniors think age alone explains their health problems. But what if the real issue is the way doctors see you? What if some of your complaints are brushed aside, or your goals in life are quietly ignored? This is not about blaming doctors. It is about uncovering 5 ugly truths that could change the way you approach every appointment from now on. Stay with me until the very end, because the last truth may completely transform how you protect your dignity and your health. If you want more strength, more clarity, and more respect in your later years, you cannot afford to miss this. And before we begin, make sure to subscribe and turn on the notification bell. This way, you never miss an important video that could help you live longer, healthier, and with more confidence. Now let's start with the first truth. Number 1, they often assume most symptoms are just old age. This is one of the most frustrating realities seniors face. You walk into a doctor's office with a concern, fatigue, joint pain, dizziness, forgetfulness. And instead of digging deeper, you are told, that is normal at your age. This simple sentence can cost lives, because when symptoms are brushed off as aging, the urgency to investigate further disappears. Shortness of breath may be dismissed as slowing down, when in fact it could be early heart disease. Forgetfulness may be laughed off as a senior moment, when it could be a side effect of medication or a thyroid imbalance, both of which are treatable. By assuming age is the explanation, real opportunities for prevention are lost, and recovery is delayed. Why does this happen? Not always because of neglect or cruelty. Doctors today are under pressure to see more patients in less time. When they hear a familiar complaint from an older patient, it becomes tempting to give the simplest answer. But simple is not always accurate, and the cost of that mistake falls on you. Depression overlooked, vitamin deficiencies missed, even early-stage cancers ignored, because the label of aging covered them. I once heard the story of Robert, an 82-year-old man. He felt constant fatigue and dizziness. His doctor told him it was age. Rest more. Slow down. Months later, Robert demanded further tests. The truth emerged. He had a heart valve problem, a condition that could be corrected. After surgery, his energy came back. He said he wished someone had taken him seriously sooner. This is why you must never accept age as the final answer. Aging is not a blanket explanation. Yes, our bodies change, but every new pain or shift in health deserves a careful look. A persistent cough, unexplained weight loss, sudden weakness in your legs. These are not things to dismiss. When doctors move beyond age-based assumptions, they uncover problems that can be treated and lives that can be improved. Your health is as valuable at 80 as it was at 40. You deserve the same thorough attention, the same investigative spirit, the same urgency. So what can you do? Speak up. Ask questions. Do not settle for quick reassurance. If your doctor says it is normal for your age, reply with this: normal is not enough for me. I want answers. I want tests. I want clarity. Bring a notebook to appointments. Write down your symptoms. Note when they started, how they feel, and how they change. A detailed account forces deeper evaluation, and it shows your doctor you are serious. Also, never hesitate to ask for a second opinion. Doctors are human. They carry biases. But another set of eyes may see what the first one missed. Remember, the danger is not just misdiagnosis. It is lost time. Time where your health could improve. Time where your energy could return. Time where you could live more fully. Do not let age become a wall between you and proper care. Break it down with persistence, with questions, and with the courage to demand more. If you are still here, and this message resonates with you, comment the number 1 below. Your voice matters. Now we move forward. Because the second truth reveals another hidden bias, one that directly shapes the kind of treatment you are given, and sometimes the care you are denied. Number 2. They may believe older patients are less likely to follow treatment plans. This is another quiet but damaging assumption. Some doctors carry the belief that once you reach a certain age, you will not or cannot follow complex instructions. They think memory issues will stop you from keeping track. They imagine poor hearing will block you from understanding, or that handling multiple medications will simply be too much. So what happens? Instead of giving you every option, they simplify, they hold back, they leave out advanced treatments because they assume you cannot handle them. The result? You receive less care than you deserve. This is not always intentional. Sometimes it comes from past experiences, other times from stereotypes about aging, but the impact is the same. You are denied the chance to decide what is truly best for you. Think of Carol. At 79, she was diagnosed with a heart condition. Her first cardiologist handed her a basic plan. No complex treatments, no detailed explanations. He assumed she would not want anything demanding. But Carol did. She wanted to fight for her health. She wanted to take every step possible. So she changed doctors. Her new physician explained everything. Every medication option, every diet strategy, every exercise routine. This time she was given the whole picture. And with it, she regained control. Her health improved. Her confidence returned. Because someone finally believed in her ability to act. This story carries a lesson. Older age does not erase the ability to learn. It does not erase commitment, and it certainly does not erase the right to choose. Many seniors today are fully capable of managing detailed plans. Some track medications with apps. Others write schedules in notebooks. Some research conditions online to better understand their bodies. The truth is simple. Following treatment is not about age. It is about willingness, support, and clear communication. So how can you break this stereotype? Show your doctor you are engaged. Bring a notebook. Ask for written instructions. Repeat back what you heard to confirm accuracy, and ask questions until everything is clear. This proves you are not passive. You are active. You are ready. Imagine the difference. A doctor who once hesitated to offer advanced therapies now sees your determination, now trusts your commitment, and now gives you access to options that could transform your health. This is not just about medication. It is also about lifestyle changes. Doctors may think exercise or nutrition adjustments are too hard for seniors, but many older adults prove them wrong every day. You can adopt new habits. You can build new routines. And you can see the benefits in strength, energy, and independence. If you feel your doctor is holding back, say this clearly. I want to know all my options. Give me the complete plan. Do not decide for me. Let me decide for myself. This shift in conversation changes everything. It shows you are the leader of your health journey. and it reminds doctors to respect your role. Remember, you are not less capable because you are older. You are simply experienced. And with that experience comes discipline, the ability to follow through, and the right to be fully informed. If you are still watching and you believe seniors can take control of their care, comment the number 2 below. It is a small way to show the world that age does not equal weakness. It equals wisdom and determination. Now, let us move forward. Because the third truth reveals something even more uncomfortable. A truth about how doctors may choose who to prioritize, and why seniors are often pushed quietly to the side. Number 3, they may prioritize younger patients in certain situations. This truth is not easy to hear, but it is real. When resources are limited, when time is short, when a doctor has to make quick choices, younger patients are often placed first. Why does this happen? Because of a hidden belief that younger people have more years to gain, more life to protect, more return for the effort. So doctors may instinctively devote more energy, more time, more aggressive treatment to someone 20 or 30 years younger than you. But here is the problem. This reasoning overlooks something critical: the value of improving quality of life at any age. At 75, at 80, at 90, you still deserve to feel strong, capable, and pain-free. A treatment that gives you independence, that helps you walk again, that lets you spend time with loved ones, is just as valuable as saving years for a younger patient. Yet in busy clinics, this bias quietly shapes care. Older patients may be told tests are not necessary because symptoms are blamed on aging, while younger patients with the same signs are tested immediately. It also appears in surgery recommendations. A physician may avoid suggesting a procedure, thinking recovery will be too difficult, without even asking if you are willing to take that challenge. Let me share the story of Richard. He was 82 when knee pain became unbearable. His doctor dismissed knee replacement surgery. Too risky, he said. Too much for his age. But Richard was still active, still healthy, and eager to stay that way. So he sought another opinion. The new surgeon evaluated Richard's actual health, not just his birth year. He approved the surgery. Richard recovered well and soon returned to his daily walks, the walks he had missed for years. This story carries power because it shows how wrong assumptions can limit your life and how speaking up, seeking another voice, can change your future. Doctors are trained to weigh risks and benefits, but age should be one factor, not the deciding factor. Your overall health, your mindset, your goals, these matter just as much. So what can you do if you feel pushed aside? Communicate openly. Say what you want from your care. If you want to stay active, if you want to walk again, if you want relief, tell your doctor clearly. Do not let them assume your goals are small. And if you feel your needs are being ignored, it is not disrespectful to seek another opinion. It is protecting your health. You must remind doctors of this truth. The question is not only how long will you live, but how well can you live? And that difference can reshape the care you receive. Never forget, every year matters. Every day matters. Because your time is valuable at any age. If you are still here and believe seniors deserve equal priority, comment the number 3 below. Your voice challenges the bias. Now let us continue. Because the fourth truth reveals another hidden assumption, one that quietly reduces the importance of your dreams. and limits the kind of care you are offered. Number 4, they may see your life goals as less important. This is a hidden truth many seniors never realize. Some doctors unconsciously assume that once you reach your 70s or 80s, your priorities shrink, that you only care about comfort, basic stability, and nothing more. But is that really true? Of course not. You still have dreams. You still have plans. You still want to live, not just survive. Yet this mindset shapes care in quiet ways. A doctor may hear you complain about knee pain and only focus on painkillers. Rather than exploring surgery or physical therapy, because they assume you just want relief, not restoration. They may recommend the quickest, easiest treatment, instead of discussing options that require effort but bring greater rewards. Because they think effort no longer matters to you. This way of thinking can rob seniors of rich experiences. Let me share Ellen's story. She was 81. She dreamed of visiting her granddaughter overseas, but Ellen had a chronic lung condition. Her doctor suggested staying comfortable at home. Focus on rest, he said. Travel is not realistic. But Ellen refused to accept that. She switched to another physician. This doctor listened carefully. He asked about her dream. He respected her goal. Then he created a plan. Targeted exercise, adjusted medication, support for travel demands. 6 months later, Ellen boarded that plane. She hugged her granddaughter. She saw a new country. She lived a moment she thought she had lost. That single story carries a lesson for every senior. Your life goals matter. Whether it is gardening, joining a choir, traveling to see family, or simply walking to the park without pain. These are not luxuries. They are vital parts of living. If your doctor never asks about your goals, bring them up yourself. Say them out loud. This is what I want to achieve. How can my care help me get there? When doctors see you as more than a patient, when they see you as a person with dreams, their advice can shift from simply maintaining to actively improving, from comfort alone to fulfillment. And remember, goals are powerful at any age, at 40, at 60, at 90. The size of the dream does not matter. What matters is honoring it. Medical care should never be limited by assumption. It should be shaped by who you are and what you hope for. So do not stay silent. If you want to return to gardening, say it. If you want to dance again, say it. If you want to travel, say it. Your voice defines your care. Because the truth is this: living better is just as important as living longer, and both are possible. If you are still with me and believe seniors deserve to have their goals respected, comment the number 4 below, because your story matters. Now let us move to the 5th truth, one that is often ignored, but has the power to affect not only your health, but also your spirit. Number 5, they may underestimate the emotional impact of aging on health. This truth is often invisible in a clinic room. Doctors are trained to measure blood pressure, to track blood sugar, to listen to your heart and lungs. But they are not always trained to ask, how are you feeling inside? Aging is not just about joints and lab results. It is about loss, change, adapting to a new pace of life, and sometimes living with reduced independence. Too often, sadness is brushed aside, anxiety is dismissed, loneliness is ignored. Doctors may think that is normal for your age, but there is nothing normal about suffering in silence. Emotional pain does not stay in the mind. It spreads to the body. It affects sleep. It disrupts appetite. It weakens the immune system, it slows recovery, and it steals energy. Think of Leonard. He lost his wife of 54 years. His health began to fall apart. Each doctor visit focused only on medications. Adjust the dose. Add another pill. But no one asked about his grief. No one asked if he had support at home. It was a neighbor, not a doctor, who suggested counseling. And when Leonard finally spoke about his pain, when someone finally listened, his health improved, not because of new prescriptions, but because his emotional weight was lifted. This is why the emotional side of aging matters. It is not separate from your body. It is woven into every heartbeat, every breath, every step. Doctors may not always see it, because you may say, "I am fine," even when you are not. But hiding these feelings does not help. It keeps you unseen. It keeps you untreated. So what can you do? Be open about how you feel. If you are lonely, say so. If you are anxious, say so. If you are grieving, say so. It is not complaining, it is giving your doctor the full picture. A good doctor will use that information to adjust your care, maybe recommending counseling, maybe connecting you with support groups, maybe helping you find purpose again. And here is the most important point. Addressing emotions is not weakness, it is strength. Because when your mind is supported, your body recovers faster, your energy returns, and your will to live grows stronger. You are not just a set of numbers on a chart. You are a whole person, with history, with feelings, with needs that deserve respect. So never let anyone tell you emotions do not matter in medicine. They do. Sometimes as much as any drug, sometimes even more. If you are still watching this, and you agree that emotional health is just as important as physical health, comment the number 5 below. Because your story can remind others that feelings are part of healing. Now we come to the final thoughts. A conclusion that ties all 5 truths together and shows you how to step forward with strength, confidence, and dignity in every medical visit. Final thoughts. Hearing these 5 truths may stir deep feelings. Some of you may nod because you have lived them. Others may feel hurt because they confirm your own fears. But the purpose of sharing them is not to attack doctors. It is to prepare you, to remind you that your health and your dignity are still worthy of full attention. Aging does not make you invisible. Your complaints are not less important. Your dreams are not smaller. And your emotions are not weaker. Every part of you deserves to be seen. Every part deserves to be treated with respect. So what can you take away from this? First, never accept age as the only explanation. Ask questions, push for answers. Second, show your doctor that you are committed to your care. Take notes, follow plans, and prove that seniors can handle complexity. Third, remember that your life has value no matter your age. Do not let anyone quietly place you behind someone younger. Fourth, speak up about your goals. Tell your doctor what you hope to achieve. Fifth, share your emotions. Let them know when you are hurting inside. When you do these things, something powerful happens. You stop being a passive patient. You become an active partner in your care, and the quality of your life improves. Think of the people you heard about today. Robert, who refused to accept fatigue as normal. Carol, who demanded a full plan. Richard, who sought another opinion and regained his walks. Ellen, who refused to give up her dream of travel. Leonard, who healed after speaking about his grief. They remind us that age is not the end of growth. It is a stage where strength comes from persistence, and healing comes from being heard. So as you walk into your next appointment, carry this mindset. You are not just a chart. You are not just a date of birth. You are a whole person, with history, with goals, with value. If you ever feel dismissed, it is not a signal to give up. It is a signal to speak louder. Seek another opinion, or find a doctor who will truly listen. Because the best care happens when doctors and patients work as a team, and you deserve that team. Before we close, I invite you to stay connected. Subscribe to this channel for more science-based insights, practical advice, and encouragement to help you live stronger and longer. Your support allows us to keep creating content that matters. And share in the comments one lesson you are taking from today. Tell us how you will use it in your own life. Your voice not only inspires us, it inspires thousands of others who are on the same journey. Remember this: your health is priceless, your life is meaningful, and your story is far from finished. Thank you for being here today. We look forward to walking beside you every step of the way.